This is Kristen Beverly, and I'm going to be discussing the road to menopause. A woman's ovaries make the hormones estrogen and progesterone. These hormones control menstruation and ovulation. Menopause occurs when the ovaries no longer drop an egg each month and menstruation stops. It is a time when those hormones also slow down in their production, and it's a natural process, but it may come with some unwanted side effects. There are three main stages. Perimenopause, or the years leading up to your last period. This is when cycles can become irregular. They may become shorter, or they may become longer. Your flow may get heavier or may get lighter. And you start to experience vasomotor symptoms such as irritability and hot flashes. Menopause is 12 months with no period. It means the end of fertility. The diagnosis is usually clinical based off symptoms and your assessment, but there are some labs that can be done. You have an increase in those symptoms, and your goal is symptom reduction, and you may consider hormone replacement therapy. Postmenopause would be the years following menopause. You start to see a reduction in the symptoms, but your patient is going to be more at risk for developing osteoporosis and heart disease. These are those vasomotor symptoms: hot flashes, weight gain, insomnia, mood changes. They may have headaches, vaginal dryness, painful sex, and they may report some loss of hair. Your risk factors associated with menopause: high blood pressure, stroke, elevated cholesterol, heart disease, diabetes, osteoporosis. Those risk factors are based on this lack of estrogen. During menopause, estrogen levels drop and the level of fats in a woman's blood can increase. These changes put women at risk for developing circulatory disorders such as your hypertension, high cholesterol, stroke, and heart disease. It can also do for diabetes. For a clinician, you want to remember this is especially important for those patients who do not exercise and who are not active. Your key questions during your workup: when was their last period, and are they taking any forms of contraception? If they're on a pill or a device that slows down their period or gives them 3 periods a year, that's going to affect that 12-month window with no cycles. So you need to be aware of that. You want to ask them if they personally have any history of osteoporosis or heart disease or diabetes, or if they have any family history. If they do, then they're going to be more at risk for developing these diseases, and you're going to put them on a more routine follow-up. You want to know what symptoms are they having and include any vaginal issues, and you want to know how they are feeling about this process in their life. Menopause leads to bone loss. Again, the lack of estrogen causes your risk for osteoporosis to increase. A woman may experience as much as 20% drop in bone density in the first 5 to 7 years after menopause. Your assessment components: you want to know their age, you want to know their history of menstrual cycles, you may possibly want to know if they're pregnant based on their age, you want to know what symptoms they're having. Look at them. They may look unkempt, they look stressed out, including what symptoms they tell you. You want to know the results from their last pelvic exam. If you don't have one, you may want to check yourself. You may look for the lack of estrogen may cause their vaginal mucosa to be pale or irritated. You can check FSH, TSH, and estrogen levels. FSH may increase during perimenopause and get high during menopause. TSH is important because it may rule out thyroid disorders as a cause for their irregular periods. Vitamin D and calcium levels are good things to check. Again, this will be key for their bone loss. And then if they're over 65 or have risk factors, then you want to refer them for a bone density test. Priority teaching: exercise, mainly weight-bearing exercise. This will slow down their rate of bone loss and keep their weight in check. Also, the body produces natural endorphins during exercise, and this may help with their irritability and mood changes. You want to encourage healthy eating and also push for those foods that are rich in calcium and vitamin D to prevent bone loss. You want to refer them for healthy lifestyle changes, no smoking, decrease alcohol, and find those good coping mechanisms. Hormone therapy. This may be a consideration. It can increase their risk for heart attack and stroke, but it can reduce their symptoms. So short-term therapy is best. And you can also consider some low-dose vaginal estrogen therapies or creams or vaginal moisturizers to help with those symptoms. Basically, for your clinician, as a clinician, you want to examine their risks and weigh the pros and cons before putting them on a hormone replacement therapy. In conclusion, menopause is a natural process. It signifies their end of fertility. You want to remember that they're at risk for osteoporosis and heart disease, and your key treatment is going to be symptom reduction. And just remember to keep the patients happy and focus on the good.